Hippocrates, of course, said, first do no harm. Who can it harm? And there are different kinds. We have a question here about someone perhaps with a reduced immune system, all kinds of things. Who can it harm? Obviously, we don't want maybe pregnant, breastfeeding women to do intermittent fasting. So first, do no harm.
Good question. I think, as we have alluded to already, there's a concern about eating disorders, and if somebody has a propensity towards eating disorders, any type of eating disorder, we'd probably proceed very cautiously with recommending any sort of intermittent fasting approach, because it could, I say this without having any randomized controlled trial to support what I'm about to say, but the idea of modifying their eating pattern such that you're restricting calories theoretically has the potential to worsen their condition. Individuals who want to gain weight, it has the potential to be maybe not the best approach, because it's very difficult to gain weight when you're engaging in time-restricted feeding. And I know many of the women are looking at me like, really? But that is a true case. So if somebody is really wanting to put on weight, this would probably not be the approach. And in particular, individuals who are older adults, at this point, we don't really know what effects an intermittent fasting approach would have. And there's a condition called sarcopenia, which is the loss of muscle that occurs with aging. So you want to be very cautious in recommending any sort of calorie restriction or even intermittent fasting regimen to an individual who has the risk of sarcopenia. So I'll stop there.